Alcohol and substance use. A large meta-analysis recently reported that 16% of residents have at-risk drinking. Similarly, in large national studies of U.S. physicians, around 14% of male physicians and 20-some% of female physicians have alcohol abuse or dependence. The use of other substances is of lower prevalence among physicians, although, as you can see on the chart, about 15% of U.S. medical students are using marijuana. There are multiple contributing factors as to why physicians are using alcohol and other substances. Often it's to self-medicate. We know that physicians with burnout and depression who struggle with work-life integration, have a substantial amount of debt, and interpersonal relationship problems are more likely to have at-risk drinking, substance abuse, and dependence. And this can have multiple ramifications both personally and professionally. Problematic alcohol use and illicit substance use can have profound repercussions on your ability to practice medicine. It can have implications to your medical licensure that can result in suspension. And we know that in most states, if you get a DUI or DWI, you have to notify the medical boards within 30 days. Some physicians, due to stigma and feelings of incompetence, leave medicine because of their struggles with alcohol. Others have a sense of their public image being damaged and being under increased scrutiny. We know that physicians who have alcohol abuse or dependency trouble are more likely to perceive that they have committed a major medical error. Furthermore, alcohol is well known to increase impulsivity, and among those with suicidal ideation, there's an increased risk of moving from idea to action. For those feeling distressed, it's even more important to get help for alcohol use. If you're feeling distressed or suicidal, please take a look at the tab for emotional health and suicidal ideation and get help. The 2010 Dietary Guidelines for Americans recommend that if you choose to drink, you do so only in moderation. And that would mean 1 drink a day for women and no more than 2 drinks a day for men. It's important to remember that substance abuse is treatable and it's reversible. Physicians have an excellent prognosis when the problem is identified early and appropriate intervention is started with treatment and monitoring. Relapse rates for physicians is actually lower than that of the general population, and physicians can safely return to practice after they've engaged in treatment. It's important to start off with a good trajectory by establishing good practices today. Don't use substances as a coping strategy for stress. And if others express concern about your alcohol use, please listen. Volunteer for treatment. I encourage you to explore the other sections on the resource page pertaining to alcohol and substance use. You will find phone numbers for local resources at your center, including support staff who may be able to meet with you individually. There are also links to select publications providing additional information on the topic and links to other activities that might be helpful,